very useful device and very inexpensive. And you can practice with it, then just roll it up and put it in a Ziploc bag. It lasts forever.
That's a good thought, that whenever I go cutting with the chainsaw, I should wrap those together with a heavy rubber band or something, stick them in my pocket.
The Ready Life, into the country.
Hi, I'm Lisa Meissner.
And I'm Nick, her husband.
Welcome back to the Ready Life podcast, where we show you how to make your home and family as independent as possible for those basic necessities like water, heat, food, and the power that most of us depend on for these things.
That's right. And in this episode, we have some special guests with us to discuss a really important topic that I think is on a lot of our minds. I know it certainly is on ours, living in a remote area, and anyone else who's living in a rural setting or remote setting. You think about, what would happen if we had a medical emergency. And my mind instantly goes to, I think it was 2 years ago, something like that, where we were riding our bikes on the Forest Service road. And we went down this one hill. And of course, Heidi was 5 years old at that point in time. Mm-hmm. And her, the little 5-year-old bikes, they're not that great. And she got going down this hill and she couldn't stop. And Lisa was right next to her. And I remember hearing this blood-curdling scream behind me of Lisa calling for me. And I had never heard her scream like that. And I looked back and there was blood everywhere. And it was, it was quite a hair-raising experience. She landed on her head and had a big gash on her forehead and was just bleeding profusely and all of that. And it's situations like that where, we were 45 minutes from the nearest hospital at that point in time. Well, probably closer to an hour at that point in time. And so you think about, what would I do in that kind of a situation? Thankfully, that one turned out to be fairly minor. Yep. We put pressure on it and some stitches, and it didn't turn out to be life-threatening, but
we didn't, but a doctor did.
Well, yeah.
Yeah.
But anyhow, it was an interesting experience. And so we want to chat with some old friends of ours, Dave and Beth Pruett from AMP3. And Dave and Beth, we want to welcome you on the podcast. How are y'all doing?
We're super excited.
We're great. We're excited to be here. Congratulations to the two of you on your new podcast.
Oh, well, thank you very much. Very much. So just to start out, could you guys tell us a little bit about yourselves, and why would we be interviewing somebody like y'all about emergency medical stuff in a rural setting?
Well, I think this goes back, we were just talking 2012. Right?
We met Nick and Lisa.
And we had the great pleasure of meeting the two of you, and for I don't know how many years getting to do preparedness events. And I just look back at that and look at the two of you and just think of great memories of sharing knowledge and helping people that are interested in knowing how to prepare. And your intro says it perfectly. We need shelter, warmth, food, water. I was thinking about that this morning when I was taking my shower, and I thought, what is the triad or the quad? And I think it's actually 5 things. I thought faith, shelter, warmth, food, and water are the tenets that we need. And in that whole group is also medical preparedness that you need to think about. And I think that story you were relating, every parent at one level or another has experienced that. And I think it becomes more poignant in a rural setting when, as Nick said, we're not 10, 15 minutes away from getting some medical assistance. We're 45 minutes, an hour. In a winter storm could be 2 hours. I remember you sharing a story about childbirth in a winter on a road that's impassable. And I was thinking of Nick and his pickup truck. And I thought, and I've been on those Idaho roads and I know kind of what that's like. So you have to run through these scenarios in your head so that when something happens, you've actually thought about that and you have the resources and a plan to take care of those things.
Right. And what you don't know, that was with our firstborn, Nathan. What I think you may not know is that with our secondborn, she came so fast. When Heidi came, she came so fast, and our midwife lived so far away that I ended up being Dr. Nick that night, and it was just Lisa and me, and the midwife wasn't able to get there till an hour later.
You have to think about that.
Right. And so you ended up working, doing most of your time in an ER, right?
Yep. So more than 20 years.
28 years.
28 years in the emergency department.
Wow.
And very naively, I went to medical school just to be an emergency physician.
So back when we met you guys, you had started this business on the side while you were still doctoring by day, and called AMP3, and then you were doing classes on things like dealing with medical emergencies, and particularly suturing. I think that was a class that you were particularly well known for. We always had you doing that at our expos. What got you into doing that sort of thing?
You should talk about AMP3.
So AMP3 started on kind of a concept that David had. He would make these little kits and he would give them away to all of his friends, or, because David was in the Navy, and he would build these little kits and then he'd give them away. And I told him, you should make those and then sell them because they're kind of cool and they're small, compact, they'd be good for backpacking or, whatever. And he's like, no one would buy them. And I said, but you have that YouTube thing that's going on. YouTube had just started. And I said, why don't you build like 10 kits and make one of those videos and kind of see what happens with that?
So I made a video on that. And I think the video is still on YouTube. And I even put a PDF that you could download and had clickable links. And so every item in the kit was sourced and you could click on the link and get it, and then just copy the video and make the kit. And when I told Beth about this, because she wasn't into YouTube and I was just playing with it, I said, I'm getting all these emails I showed people how to make the kit. I gave them the sources, where to get the stuff. And the only thing that I got back was like, where do I buy that kit? I just thought it was funny. You gave the people how to do it, and then they want to just buy it, which is fine.
Gave them a DIY.
DIY. Do it yourself. Yeah. So anyway, Beth said, let's make some and see what happens. And how many years ago was that?
Oh, gosh, I don't know. 14 years ago.
14 years ago, we've made
thousands.
Unbelievable number, and they've gone all around the world. But we also realized there's more to it than that, and we liked connecting with people. We liked sharing what we had, sharing our blessings, and we liked teaching. And it was such a fun thing. I don't know how many people we taught to suture. There seems to be a curiosity about it, which I understand.
And so David loves that teaching kind of aspect, and he's really good at communicating with people at a real basic level on medical preparedness.
I think one of my favorite classes, I kind of call it my MacGyver medicine class, but how you could go to Walmart or the dollar store and and put together your own little blood stopper kit and do it for your whole community for a few dollars, and what those components are and how to put it together, because it's not about money and it's not about some fancy equipment. It's knowing how to take common things and make something useful out of that, and move your preparedness one chunk forward without spending a lot of money.
Mm-hmm.
Right. But I will say that having the right stuff on hand is really handy. And I mean, we've got one of your bags here.
Lisa's got her outfitter.
I love this thing.
We have literally carted that around probably around the country
Everywhere
with
we
us.
go.
Everywhere we go, when we go on camping trips, it's in the car. When we go on camping trips, it's with us in the boat or whatever. Obviously, we wouldn't take something that big on a backpacking trip,
Right.
but if it's a camping
Car
trip
trip.
where we can haul gear, it goes with us.
Yeah.
hmm And yeah, we've made a few additions or modifications or things like that. Like I've got, well, let me
Absolutely.
here. I've got my little pulse ox
Yes.
thing here that I
Great.
have thrown in just because it makes it easy to check heart rate and SpO2 levels when you're under stress. Just slip it on somebody's finger, and then you don't have to.
And then you can take a breath while you're
Great
checking.
idea, Nick. Great idea. Love
So,
that.
so Nick, you have my curiosity
Yeah.
peak, because that kit, and Beth and I put it together specifically knowing that people are going to add and modify. And so it actually has the ability built into, there's space in there, there's extra loops in there for people to add additional items. A pulse ox is a great thing to have. And I mean, I relied on that my entire career in medicine, but I think the lay public realized how valuable that is with this COVID nonsense. I don't want to say anything bad on your podcast, but this COVID.
Go for it.
Okay.
The COVID nonsense.
I'm a bad person with that, so I got to control myself. But that you could get some realistic information by monitoring your pulse ox and get a sense of how ill you were. It'd be interesting to have done that over several years in the past and know that when you had a cold or a flu feeling similar, that your pulse ox was probably similar back then, and you have something to kind of put that into perspective view, but that's a great thing to add to a kit like that, for sure.
Yes. Yeah. I love that.
So a lot of our listeners and viewers live in a country, rural setting, some even in a remote setting. So what are some of the common medical emergencies in that kind of a setting that you think it's a good idea for people to be prepared for or to handle?
Yeah, we were talking about that this morning just to kind of refresh our minds on, like, if you were asked that question, how would you answer it? And I think those medical emergencies are no different than what you would encounter if you're not in a rural setting. What's different is the setting. And like we were talking earlier, you might be 5 or 10 minutes from the hospital where you call the ambulance and they're rolling, coming to your aid. The difference if you're living in a rural setting is they may be coming to your aid, but they may also have a long response time. And so it behooves you that if you are living in a rural setting and you enjoy that freedom and liberty that a rural setting provides, and Beth and I, have our ranch, and that's what we like about it. It behooves you to say, how do I prepare myself so that if something happens, I can respond and provide that stopgap aid before I get someone where they can get more definitive care, or more definitive care arrives and can move forward. So I think they're the same things. It's just the seriousness of it is much different. What if it's in the middle of the winter and your road is all wet and then froze, or there's snow, and suddenly you're just doing normal things that someone lives in a subdivision would do is no longer available. So we were thinking about that, and I think
An AED.
AED is important. You could save somebody's life if someone had a cardiac event on your property. Electricity saves lives in that setting. So an AED. And the nice thing about it, with some minimal training, the AED actually, the point of it is that it's a automatic system that analyzes and delivers a shock when appropriate. And you just have to kind of practice to know one, to grab it, two, to put those pads on, and then how to push the buttons to make it analyze. So that's important. I think knowing how to and having the whatever you want to have to stop a serious bleeding event is important. How to splint things. All of these things are going to be potential problems on any remote setting. You could be preparing firewood this afternoon and have a chainsaw injury, and I've seen a bunch of chainsaw injuries, and they can be quite messy. You could fall and break an arm. So those things you need to kind of think through. How am I going to manage that? But the biggest thing that's going to happen are the regular little boo-boo things, minor cuts, abrasions, and burns. And how do I manage that? And what do I need to have on hand to take care of those things?
Yeah, you brought up chainsaws, and I've more than once, while I've been cutting, thinking about this and thinking, this is probably the most dangerous activity that I do.
Yes.
And just thinking about what would I do if of course I try and behave myself and wear chainsaw chaps.
Yep.
There are a few times that I slip up and forget to put them on, but for the most part, I do wear those. But I've thought about it, and if I managed to cut a artery or something like that with a chainsaw, is how quickly do you lose consciousness in that kind of a scenario? Do you have a few seconds to wrap a tourniquet on there, or does it happen so fast that that's kind of a showstopper?
So that's a great question. I think for the majority of events like that, you're going to have time. The key thing is, do you have what you need with you? And I would look at going out and preparing firewood with a chainsaw the same as going to the range and practicing shooting. I would have with me, Beth and I call it a bloodstopper kit, but to me it's the triad of a tourniquet, a hemostatic agent, and a pressure dressing. And again, I went over that in my little MacGyver medicine thing that I used to do at expos. Short of the hemostatic agent, which would be like Quick Clot, what you need is some kind of device for a tourniquet. We have settled on something called a SWAT T, and I can talk about that more later if that's interesting. And a pressure dressing. And I think the key thing is to have a pressure dressing, and that can be as simple as a large female maxi pad and a 4-inch ace wrap in a Ziploc bag that's in your chainsaw box. And if you injure yourself, I'm going to grab that bag. I'm going to put the maxi pad directly on the injury, and I'm going to wrap that ace wrap tightly around that maxi pad, making a pressure dressing. And then I'm going to get on the phone or the radio and call Lisa and say, I injured myself. Take a breath. I'm okay. I've got a pressure dressing on, but I need help. So that would be my, steps of dealing with that. But you're not going to like suddenly pass out and not be able to do anything. But I'd always have a phone and a radio so I can get help. And I would always have in my box, at the bare minimum, pressure dressing, but I would advocate for a tourniquet. And I think a SWAT T tourniquet is the best tourniquet in that scenario.
Yeah. Do you happen to have one sitting around?
I don't. Lisa probably has one.
You have one in that first aid kit in the trauma pack, should be on the left.
Yeah. I know we have. I'm afraid I might have distributed it to a smaller bag.
So Nick, you're like everybody. You end up taking things out and distributing, and that's normal.
Yeah, unfortunately, it's not in here. But anyhow, it's basically about 4 inches wide, and it's stretchy rubber.
Yeah, so it's about 4 inches tall. It's made out of EDPM, so I think it's the same stuff that's used in roofing, EDPM membrane, and it's about, I want to say, 3 feet long. The nice thing about it is if you're panicked, it actually has the instructions written on the tourniquet in white ink. But the more panicked you are, the tighter you're going to put that tourniquet on, which just makes it more effective, right? It needs to be tight enough if you have an arterial bleed. Although a good venous bleed can be quite alarming to someone, but an arterial bleed, bright red pulsatile blood, you need to have enough pressure to stop that bleeding. And it gets applied between the injury and your heart. So you need to think about, when I put it on, it doesn't go on the injury. You look at where the injury is and then mentally think where the heart is, and it goes between the two, right? And the nice thing about a SWAT tourniquet is, if you had an injury in your upper arm, it's the only tourniquet that can go up in the axilla and provide pressure that way. And it's the only tourniquet that can go up diagonally in a groin and provide pressure there. So very, very useful device and very inexpensive. And you can practice with it, then just roll it up and put it in a Ziploc bag. It lasts forever.
That's awesome. Yeah. That's good that's a good thought, that whenever I go cutting with the chainsaw, I should
Stick it in your back
put a
pocket.
pressure bandage and a tourniquet, and maybe just bandage or wrap those together with a heavy rubber band or something. Stick them in my pocket.
We probably need to get a couple more of those, so we keep one in here and one in our other bag.
Yeah, probably so.
And Nick, we actually have something called a first responder, and that would be what I would put in my chainsaw box, or even in the pocket of your chaps. Although I don't recommend that, because I'm guilty, like you are, and I have used my chainsaw without grabbing my chaps. It's not the smart thing, but I'd rather have that in the fuel wrench box that goes with the chainsaw, or at least, there. So, and that has it has a pressure dressing and
Tourniquet.
Pressure dressing and tourniquet, and a pair of EMT shears.
Yep, so you can cut your pants off.
That's a good idea. And just in case anyone's not familiar with chainsaw chaps, they're basically, they look like a little bit like cowboy chaps, except you'll see like a Cordura material on the outside, and on the inside is Kevlar, but it's not like a ballistic vest that stops bullets. It's not like that thick.
Right.
It's really thin, flexible layers of Kevlar, where it really does feel like just kind of a thick fabric. And what it does is, if your chainsaw hits the chaps, those strands of Kevlar get stuck in the teeth and instantly, I don't know how to say it, jam it up, where it stops the chain like fraction of a second. Yeah. And we have friends, at least one friend in particular, that took that for a ride, and it probably saved his life. He was out in a very remote setting cutting, and he got tired. As my dad would say, he committed the cardinal sin of cutting with a chainsaw, and that's to cut when you're tired.
Yeah,
and
exactly.
So he got tired and pushed, and I guess was undercutting and pushed up with his leg knee. And pushed his knee right into the chain.
Oh.
And yeah, there's no telling what would have happened, but it instantly stopped the chain in his case. And he ended up with just a little scratch that a Band-Aid took care of. So pretty amazing.
Good.
I love the ending of that.
Yeah.
Love the ending of that story.
Yes.
Yeah.
And your dad was a wise man with a huge smile, and I can hear him saying that. And it sounds so mundane to say that, but it's so profound to say cutting with a chainsaw when you're tired, not a good thing.
Yeah.
Yep. For sure.
Yeah.
I've heard of people using super glue for stuff. Is that a good idea, bad idea? Like, they get a wound that maybe is kind of borderline, probably should, maybe get some sutures, but it's kind of borderline. I've heard it around the internet, so it must be true, that that you can just use super glue, and that's basically the same thing as the glue that they use in the ER. What are your thoughts on that?
Yeah, so I've heard it on the internet too, so it has to be true if two of us have heard it. No, so a lot of people do that, quite honestly. I think the thing that I see when I was practicing in the ER that, and I probably only had a handful of these. People would come in and they tried to glue the wound before coming in because they heard that it helps. And what they would do is they would just put the glue in the wound. And what happens with super glue, cyanoacrylate, it catalyzes when it's exposed to moisture. So when you put that in a wound, now suddenly you have a wound that's open, but now it's coated with basically plastic because you squirted crazy glue or super glue in there. And there's really, if you look at the molecule of, it's called tissue adhesive or Dermabond. In the medical setting, super glue is very similar. There's a couple of small molecules that are different on the end of the chain, but it's basically super glue. And if you're going to do that, you need to close the wound together. It really takes two people, someone to close the wound, and then the glue gets applied to the closed surfaces of the wound on the top edge. The other thing is you need to select a wound and know that that's the right closure technique for that wound. When we taught our suture class, I spent probably the first half of, it was always a 2-hour class, a good hour just talking about wounds, the anatomy of the skin, risk of infection, foreign bodies, and then what are your closure techniques. And we also talked about the importance of wound irrigation. I can talk about that a little bit more if you want. But much like a carpenter has many hammers or many chisels, they're all for different things. Super glue is just one of the many tools in the toolbox for closing a wound. And so you select the wound and you select the closure technique so that they're appropriately matched.
That's something. So just in general, what would you say are the key components of a well-stocked medical kit that somebody in a rural or remote setting should have?
Sure. So I would encourage your audience, they can go to I'm not trying to sell our website, but you can go to our website and go to, we call it the Outfitter. It's the one that you're holding there. We also call it a clinic in a roll. That to me is a good foundation. If you wanted to build a kit, you can go to our website and just take our list and then use that as a shopping list and put together a kit. So what are the things that should be in there? One, we talked about earlier, trauma. You need to be able to have the tools to stop bleeding. So for us, that's hemostatic agent, Quick Clot. You can go to us. Nowadays, you can get that in a sporting goods shop.
I think REI might.
REI.
Yeah, they might sell it there.
You can. It's available. You can buy it on the internet. A tourniquet. Again, we like the SWAT T, and then a pressure dressing. Hands down, the best pressure dressing out there is the Israeli trauma dressing. I would get a 4-inch or 6-inch Israeli trauma dressing. So that is the triad for dealing with blood, bleeding. We call it MSK or musculoskeletal module. So it's just go to the dollar store, Walmart, get a ice pack, an ACE wrap,
Tubular gauze. I think
yeah.
you have to go to a medical supply store for that.
You can go. The other thing, if you're living near a big city, when you're in shopping and getting supplies, go to what would that be called? A
medical supply store.
Like a medical supply store. So in Beaverton, it would be like Beaverton Pharmacy, but they had all the supplies for taking care of people at home that came home from the hospital. Mm-hmm. All those wound care items are the same. So you can get those things at a pharmacy that deals with long-term care. So Zeraform gauze pads, tape, all of that stuff is readily available. Over-the-counter medications, Tylenol, ibuprofen, Benadryl. So Benadryl is good for itching and rash, but also if someone started having an allergic reaction, 2 Benadryl tablets can be a great stopgap until you get them to help. That doesn't mean you've treated them and you shouldn't get help. But the first thing I would do is if, they're talking to you and can swallow liquids, give them 2 Benadryl and then start heading to the emergency department.
But also,
our list would be a great, just steal it from us.
Also, another great thing to think about is Jace Medical. And we're an affiliate, so you can go to our website, hit Jace Medical, it will take you right there. But this is a wonderful kit that David and I, we've known about this company for about a year and a half, probably about a year and a half. And it's a kind of a new company. But I have to say, if you need prescription medications, this is kind of a bad image, but anyway, this kit comes fully stocked with all of your prescription medications, including ivermectin. So this also includes ivermectin. You can order it, and if you are someone who is on like long-term prescription medications for heart, for vascular or whatever, they will give you a 1-year supply.
Well, they give you a prescription for 1-year supply, and then you pay for it. It gets filled by a pharmacy.
By them.
Yeah, by them, and they send it to you. But so Nick, we're not trying to sell this, but the neat thing is, so Beth has one that's for her, and then I have one for me.
And
the reason we're mentioning this is one of the things that we would get asked a lot
all the time
at expos, or some guy would want to come up and talk to me about, it was usually me and you wouldn't rescue me, but they'd want to know like what fish antibiotics should I get and what fish antibiotics should I stock up on, and or horse antibiotics, right? So is there a difference between amoxicillin that's used for fish and amoxicillin that's used for horses and amoxicillin that's used for humans? The answer is no. Amoxicillin is amoxicillin. It might be called fish mox for fish, etc. And what changes is the dosing per weight. So the dose that the 2,000-pound horse would take would be different than the overweight 180-pound bald ER doctor, right? And I always struggled with those conversations because I didn't want to say, go out and buy, 40 pounds of fish mox or whatever. But this is great because now you have a way to access long-term medications and antibiotics that could be life-saving.
That's awesome.
Yeah, that really is awesome. It's really interesting you mentioned all of this. Going back to the Benadryl, I was doing dishes at my kitchen window overlooking the porch, and I watched our cat, and she got stung on her tongue, and I watched it happen.
Or somewhere in your mouth.
Yeah, or somewhere on her mouth. Anyway, and her reaction was severe. Like she raced off the porch, but I don't know, she just kind of froze, and Nick was able to run and grab her. And thankfully, I had the children's Benadryl
in a liquid
on hand.
form. Yeah.
And so we were able to give her some right away, because I think if we hadn't, we would have lost her, because she was
losing her airway.
Losing her airway and everything. It was intense for, 4 hours. I think we sat with her screaming on our lap while we were trying to get Benadryl down her. And
you must have had a syringe then for giving liquid medications, oral syringe for giving it to a child. So that is such a key thing. So if you've got children, you need to have the adult medications in a liquid form, and then also know what the dosing is per, for weight, and then also have the syringe.
You're right. I grabbed one of those little syringes, and that's how we gave it to our cat.
Wow.
Excellent. I could see the two of you doing
but yeah, we were talking, mentioning antibiotics, heart meds, Benadryl, things like this. And, we are definitely of a more natural mindset. We use more of the simple natural remedies as much as possible, but there are situations and times where there isn't a really good natural solution, and you've got to, high blood pressure for one thing. Yes, there's a lot of natural things you can do to get it down with lifestyle, But in the meantime, at least, until you get it there where you've got it under control, you have to get that blood pressure down, or else you're going to stroke out
Right.
or something. And so there's times where these things, whatever mindset you are, whether you're more of a lean allopathic or you lean natural remedies side, whatever the case may be, there's a time and a place for these things, and it's good to have them on hand. Antibiotics being another example. Yes, there's a lot of concern about antibiotics being overused.
Yep.
But there is a time and a place where it could save your life.
Right.
Exactly. And Nick, this just made me smile to hear you just talk about that. And it just another great thing about you guys, and very insightful. So allopathic medicine is going to deal with the prescriptions that we're talking about. But if you look at the history of medicine, all of these medications have their foundation in the natural world. And so there are a lot of natural remedies that are useful and effective. And many times we don't need these prescriptions, which really are, and I'm showing my bias, but Beth knows that I've gone through sort of a revision of my world of medicine, and I'm struggling a little with it. But those medications are the pharmaceuticals are petrochemical derivatives, organic chemistry, and they have their place too. But I think their place is overstated and over pushed with media and marketing, and many times they don't need to be used as much as they're being used. And there is a push in medicine right now to be using less of these things as we've learned more about them. So even blood pressure medication is sort of being rethought a little bit.
Yeah, right.
So are there any specific medical skills or techniques that you believe every homesteader should know?
This is a question that we would get asked a lot at expos, like, where do I go to get more training or get training in this and that? One old standby, of course, is the American Red Cross. They do have some excellent training materials for first aid, for preparedness, like for earthquakes and that sort of thing. Where else can you go to get training like that? I would look at a wilderness first responder is a great place to learn those practical hands-on skills.
Yeah, I'm so glad you brought up the wilderness first responder training because, I guess it was maybe about 15 years ago, I took a wilderness EMT course.
Yes.
It was like a month-long thing, but I remember looking at the curriculum for the wilderness first responder, which I believe was like a 1 week if you did it full time. And I was really impressed with how much they pack into that. And I remember thinking that, I'm glad I did the wilderness EMT, but I remember thinking that if I had been short on time or whatever, the wilderness first responder would have been a really good route to go.
Yes. And I think the wilderness first responder, you can do it in a week. And there are even course offerings where you can do it over 2 or 3 weekends. So that week is broken up.
Yeah, it's true. But I will say, if you don't use it, you lose it.
Yeah. So again, very insightful, Nick. And again, this is true with all motor skills, right? If you don't use it, you lose it. And practice is everything. So here's a scenario for you. Every time you go and cut firewood, or maybe every other time you go cut firewood, take a moment and take out your tourniquet and just put it on your leg, and just have that scenario.
When you asked that question, Nick, I also thought you have those 2 wonderful little children that you could be using as your patients, and they would love that.
I'm sure Nathan
would love that.
Nathan would be a lot of fun to say, hey, I'm going to put a pressure dressing on your thigh.
I'm going to see how this tourniquet works.
Or your forearm, and then I want you to put it on Dad.
Yeah.
Suddenly now you're doing forced multiplication, right?
That's called homeschooling.
That is so true.
It's a great idea.
So true. And that brings up the thought that if you're going to do that, then when you're getting your pressure dressings and tourniquets and whatever, you want to get an extra one for training.
Right. I used to say this in that MacGyver medicine class that I did. I always pulled out a Israeli trauma dressing, a tourniquet, and a quick clot in their package. And I'd hand them around, let people look at them while I was talking. Then I'd gather them back up. And I'd ask people so I had a couple of questions. How many people have this in your first aid kit? A lot of people would raise their hand. How many people have opened any of these? All the hands would go down. Maybe one or two would stay up, but almost always all the hands would come down. So I'd pick on somebody. Hey, Nick, how come you have it, but you've never opened it? Well, those are like very expensive. And so I'd always say, get one and don't open the quick clot. You don't need to do that, but get an extra one, open up the Israeli trauma dressing, open up the tourniquet and practice with it. When you're done, roll it up, put it in a Ziploc bag. You could still use it in a real life scenario. They don't need to be sterile. This was always a fun talk to have with people about sterility. And I can talk about that more later, but put it in a Ziploc bag. Now that becomes my range kit. And I pull it out at the range and say, hey, Nick, before we shoot, let's just quickly practice. Do you want to put a pressure dressing on me? And then I'll put one on your forearm, just so that we know how to do it. And then you roll it up and put it back in your range bag, or it goes in your chainsaw box or in the back of your truck. And now you're using it. After a while, it's going to get a little dirty. Throw away or maybe hang on to the pressure dressing. But the tourniquet, you can just wipe off with alcohol and just keep it clean. It's not important for it to be sterile. You're outdoors. You can't be in a sterile environment. So that's always surprised me when people say, oh, it's not sterile. What about anything around us right now is sterile? So we're not in an operating theater and we're not gowned up. So you're doing clean procedures, not sterile procedures.
Yeah, those are some awesome ideas. One thing you mentioned, quick clot. Could you just real quick tell us what is quick clot and what kind of scenarios would you use it?
Yeah, so quick clot, a lot of the stuff comes from the military, right? So quick clot is called a hemostatic agent. There are several on the market. They are agents that trigger your natural clotting mechanisms to form a clot to help stop bleeding. Quick clot needs to be applied correctly. So you don't just put it on top of a wound, you stuff it in the wound, and then you stuff compressive dressing gauze in there, and then you put a compressive dressing on top. So you pack the wound. That quick clot in the wound is going to trigger the clotting mechanism, and you'll start forming your own clot, okay? So it has to be applied in the right space. If you look at the active ingredients, almost all of them are refined kaolin clay, and it just triggers the clotting mechanism.
What kind of scenarios would you use it in?
It's used for arterial bleeding. It can be also used in venous bleeding. I think the lay public probably overuses it. Most of the venous bleeding is stopped and controlled with a pressure dressing. So if you're going to put quick clot in a wound, you're going to be doing a tourniquet between the wound and the heart and putting a pressure dressing on top. So they go together as a triad.
So in your opinion, what do you think is the most overlooked aspect of rural medical preparedness?
Training.
I was going to say it's not a physical product, it's training and a plan.
I'm so glad you mentioned that because it's true. It's true. So what's one piece of advice that you'd like to leave our listeners with when it comes to being prepared for medical emergencies in a rural setting?
I would say for me, the most important thing to leave with your audience is None of this stuff is beyond your reach. It's not. Why did we teach suturing to farmers in Missouri? You would say, oh, they can't do that. You know what? I know 20 farmers with coarse hands and dirt under their fingernails that can. So this is not complicated stuff. It's not impossible stuff to learn. If you go about things the right way, it's not expensive stuff to accumulate. And are you going to be an expert at it? No, but that's not the point. The point is not to become an expert. The point is to become facile and self-reliant when the situation presents itself that you need to be self-reliant. Most of the time, if something happens in our family, we go and get help. But do I know how to do something if maybe that opportunity doesn't exist? Yes. So having that skill and having procured the training and the materials gives you one more degree of freedom and liberty that you have that you didn't have before.
Yeah, I would just say, first of all, thank you, Nick and Lisa, for having us on. It's so fabulous to see you guys again. And we hope that you start doing expos so that we can see you more often. But I also think, just stay tuned to Nick and Lisa. They are on it. The training that you're going to get just from listening to their podcast is going to be phenomenal.
I want to add one more thing. Your YouTube channel, I think, is a super valuable resource. And Nick, you know that I used to be a fireman. I watched your YouTube video on your fire pump setup that you did. I've done a little YouTube creator stuff myself. I like how real it is. So the mistakes are not edited out like, when the hose went one way and Lisa's
or the connection was
that's
great.
That kind of real life,
yes.
Genuine to me is granular. Like this is real life. But as a fireman, I learned. I mean, we have a similar setup at our ranch with an IBC tank and a Honda fire pump. But I didn't know that, and I used to be a wildland firefighter. I didn't know that there are wildland quick connect fittings. And so I pointed that out to Beth. I mean, this is good stuff to learn, and you're not going to get it in real life, and it's not fake. So anyway,
good job.
Your YouTube channel is a great resource.
Yes.
Well, and you guys have a lot on your YouTube channel. You want to give us the name of your YouTube channel and also your website?
Sure. So our website is amp-3.net. And my YouTube channel is USNERDOC. So United States Navy ER Doc.
Awesome. I wonder what branch you served in.
Very proud of the Navy.
Well, we appreciate your service.
Thank you.
And appreciate you guys coming on here. This has been really, really insightful. And we want to have you back to talk about emergency communications sometime, because I know that's another one of your passions that you guys work on. And you mentioned it earlier, and I was just thinking that is such a critical and often overlooked area is communications. And so, we'll have to chat about that sometime. But anyhow, we appreciate you being on here. And be sure and visit Dave and Beth's website.
And get a medical bag.
Yes. And thanks, everybody, for joining us on the episode this week. And we'll look forward to seeing you back next week. And we'll talk to you then.
Bye.
Thank you, guys.